Hi, I'm Amy Grosso, Director of Behavioral Health Services at Round Rock ISD. Um, on December 7th, the Surgeon General released a brief on how we can protect youth and mental health. The purpose of the brief was to shed light that mental health and mental health care for our youth is reached a crisis level. The brief has some great information. It's a little lengthy. So today I wanted to give you a summary of some of the high points and really talk about what all of us can do to help the current situation. To begin with, there was an overview of different factors that can shape mental health. And this is mental health at any point in time for all of us, not just youth, so that we can all better understand what does impact our mental health. So there's 5 different levels that impact and have an ability to impact our mental health. The first is individuals. So each of us as individuals, our genetics, how we're made up, how we respond to things, our own experiences are part of those things that impact our mental health. Next is the family system in which we find ourselves. That can be things that really support our mental health, or maybe things that have negative aspects that have impacted our mental health. Next is the community. So this is our school community. It's the community in which you find yourself. Maybe there's a faith community you're within. So those all impact. The last is the environment we find ourselves. So what are those things around us that impact us for good and bad? And then the society is the overarching of where we find our things, self and different things like inequities for wealth or poverty. And those things can also impact someone's mental health. So to begin with, that's just an understanding of the different things that impact mental health. It then gave some background on what was mental health like for our children and our youth pre-COVID. So it's important to understand where we were before and then where we are now. Pre-COVID, up to 1 in 5 children ages 3 to 17 in the US were reported to have a mental, emotional, developmental, or behavioral disorder. So as you can see, 1 out of 5, so that was a high number pre-COVID. It was also reported in 2016 that of the 7.7 million children with a treatable mental health disorder, about half did not receive treatment. And I want us to think about that for a second. If half didn't receive treatment for other kind of physical health conditions, what would we have been doing back in 2016? The next aspect was from 2009 to 2019, the proportion of high school students reporting persistent feelings of sadness or hopelessness increased by 40%. And the last one is that between 2007 and 2018, suicide rates among youth ages 10 to 24 in the United States increased 57%. So as you can see, while a lot of focus has been put on mental health since COVID had started, it's not like mental health with our children and youth wasn't a concern pre-COVID. There was also in the brief talking about what are some risk factors that contribute to mental health symptoms that have happened since COVID. And as you can see, there's a variety of different things, such as they might have already had a mental health challenge before, and this just exacerbated it. If there was outbreaks near where they were, if their parents or family members were frontline workers or might experience burnout, then just general worry about COVID. Or routines were disrupted for all of us, which can impact mental health. Adverse childhood experiences, which is a broader area of research, but a lot of that comes from abuse, neglect, trauma, violence. Also, those who had financial instability or food shortages or housing concerns because of their family situation. So as you can see, these are all things that were added to what we're already considering a high level of mental health needs for our children and youth. It's important to know that we each have a role to play, and this has to be whole of society effort. It just can't be one part. It just can't be one individual. It just can't be the schools. It can't just be parents. It has to be all of us working together. It gave examples in the brief for a variety of different people. We're only going to focus on 3 different aspects. So we're going to focus on what youth can do, what parents and families can do, and then what schools can do. The first is, what can young people do? Remember that mental health is a challenge and it's real, but it's also treatable. And to understand that it's common, that just because you're struggling doesn't mean you're the only one, that a lot of us, majority of us at times in our life will experience troubles with our mental health in a variety of different ways. It's important for young people to realize they can ask for help and really understanding who are those people they can ask help from. Invest in healthy relationships. What are those relationships with peers and with adults that can really invest in them and improve their well-being? Also, it's important of how our youth find ways to serve. We know that the more we get out there, we connect with others, we assist, and that can have a positive impact on our mental health. It's critical for youth to understand ways to manage and stress and other emotions, to realize that there are times in our life that everything is going well and there are times where it's not. So how do we manage that stress? How do we manage some of those difficult emotions so that we can work through them, realizing that we're not going to be happy all the time, that we are emotional beings with a variety of different emotions. Youth need to realize how they take care of their body and their mind is important. How do they get sleep? Do they eat right? Do they get exercise? All of those things. And also how to be intentional with screen time. Even pre-COVID, the amount of time all of us were spending on screens had increased so much over the last few years. And so really realizing what is good for us and what is that point that it's not being beneficial and is having a negative impact on our well-being, and how we can be a source of support for others. It's important for youth to know that they can be a source of support for each other at the same time. So what can families do? They can be a role model and be a voice for mental health. I often say we as adults do a great job of telling our kids and our youth what to do, but are we as good about modeling it? If we're not talking about mental health and being a voice for mental health, then our kids won't know that we are safe to talk about it or that they're allowed to talk about it. It's vital that we help children and youth develop strong relationships with other supportive adults, even outside of ourselves, but how do we help them foster that so that they know who to go to if they are struggling? Encourage healthy social relationships with peers, that it's vital that, that children and youth have a relationship with their families, but also that social interaction and relationship with their peers is critical. Sometimes we don't have control over this as much as others, but as our best, how do we provide a supportive, stable, and protective environment? We know children and youth thrive by knowing what to expect, routines, and that stable aspect for them. Trying to minimize negative influences and behaviors. Drug and alcohol, are we talking about that with our teens? Are we letting them know that we are a person they can talk to if they're struggling with peer pressure or those types of things? Or we often know that all of us, it's not just youth, but if somebody's struggling with mental health, and they don't get the help they need, they will often self-medicate in a variety of different ways, but that can include drugs and alcohol. Do we make sure they get their regular checked up with doctors or a variety of different health providers? Also, are we looking out for warning signs of distress? And if we see those, are we able, as the families, to make sure our child or youth get the help that they need? At the end of this presentation, there'll be a link in the website for Behavioral Health Services, which we have a lot of different resources of what does it look like to actually get help for our children and youth. A big one is, do we minimize access to means of self-harm? That includes firearms and prescription medications. Are we intentional about that, realizing that those are ways that children and youth might look to if they're struggling with their mental health? Also, as adults, we have to, and the families, are we familiar with the online activities of our children and youth? And there's a lot of different ways to do that, but how do we have discussions about it? How do we have healthy discussions and not just say, don't do it, but really forming that relationship so if there is a concern, our children and youth feel like they can come to us. So those are just a quick high level of different things families can do to help the mental health of children and youth. The last one is, what can schools do? What can we as a district do? What can individual schools do to help mental health with students? The first is creating a safe, positive, affirming environment. And that's what our our principals, our assistant principals, our teachers, everyone, even from our bus drivers to our cafeteria workers, strive to do every day of how do they help to make the school a safe place for our students. Also, it talked about expanding social and emotional learning programs. Sometimes there's some misunderstanding of what SEL is. Social emotional programs are a lot of what when we think about teaching kids of what are the different feelings we have, and then how do we cope with it if we're really stressed? What do we do if we feel anger? And so that's a lot of the work that happens in the district, and that's a lot of the curriculum that's provided is helping, giving tools to our students of how to manage those things. Also, it's important for schools and staff to learn to recognize signs of change in health. That's why this year we've already trained over 4,300 of our staff members in the American Foundation Suicide Prevention Program called Talk Saves Lives. And it's really helping people understand what are those warning signs to look out for when a child is in emotional distress. Also providing continuum of supports for mental health needs. I am so thankful for the variety of different resources we are able to provide here at Round Rock ISD. From that social emotional learning that's for all students up to the support our school counselors do day in and day out on campus with students. But then we're also able to provide for students with a higher level of need with our mental health centers, our social workers, our partnership with Dell Med School and TCHAT. So really seeing that we can provide a variety of different resources for our students. And that goes with expand school-based mental health. We hired the first 10 social workers last year. We're getting ready to hire 3 more. So really understanding how do we continue to expand mental health services for our students. And the last one is support mental health of staff. We know that staff are the ones directly impacting our students. So how do we support their mental health? And part of that goes with with our employee assistant program that's through benefits and HR, but it's also we're starting to hire a staff social worker. So we'll really work of how do they help our staff in any way that's needed, and really work with our benefits and HR with wellness programs so that we're making sure to continue support the mental health of our staff. Well, this was a quick overview. The brief dives much deeper. It gives suggestions on different aspects of in the community, how they support mental health. But I really wanted to just touch on what can youth do, what can families do, and then what does the school do. As you can see, here's a link to our behavioral health website that has a host of different resources and information for you. And like I said, in the chat box, we'll also put the link to the entire brief. Thank you, and I hope this has been helpful.